Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. So last episode, we discussed NeoGraft, which is a hair transplant procedure that you offer patients here for hair loss. Can you tell me what other treatment options you offer that might be less invasive?
Sure. So one of the options we have for patients with thinning hair is something called PRP. PRP stands for platelet-rich plasma. And what this is it's a platelet growth hormone. These platelet growth hormones are something in our bloodstream, and think of it like a chemical signal our body throws out there that tells our cells to do things. And one of the things that it's been discovered that this platelet-rich plasma can turn on hair follicles. So our hair follicles are constantly growing hair, and then they stop growing hair and they go to sleep. And this cycle is continuous. Hair grows for a few months and then goes to sleep for a few months. And platelet-rich plasma can actually keep this cycle in the growth phase and improve thinning hair. So it's a way that we can get gentlemen or women with thinning hair, thicker hair, and more hair. Okay. So the nice thing about it is it's non-surgical. It's something we do in the office. So you come into the office and our nurses draw some blood from your arm. And we have a way of obtaining this platelet-rich plasma. We centrifuge the tube of blood, and we're able to obtain this platelet-rich plasma. Then we take this platelet-rich plasma and we inject it into the scalp, into areas where there's some thinning. So it does involve some shots, unfortunately, but it's a quick treatment. The nice thing about it, the whole process might be 20 minutes or so. Most people go right back to work, and really the only restriction is avoiding aerobic activity for a couple of hours, and that's only to help reduce the chance of a bruise from the shots themselves.
So you said it's an office treatment and it's about 20 minutes?
Yes.
Okay.
And there's really no downtime. People go right back to work. It generally does involve a few treatments, and we space them about 4 to 6 weeks apart. The expectations, this is not going to get you the hair you had when you were 16 years old, but it does improve the thickness of the hair. So when people study this, they find that the improvement is subtle, anywhere between 0 and 30%. But again, it's an easy way to obtain, possibly 30% more density in your hair.
Yeah. So how many treatments do you say most patients need?
We're generally right now, we're recommending 3 treatments to start, and they're each about 4 to 6 weeks apart. And then long-term, studies have shown there is some benefit to some maintenance, and we're having folks come in every 3 or 4 months for a treatment as well to keep things going.
Okay, great. And then what would the cost for this sort of procedure be?
So it depends upon how much area we're treating, but generally the cost is somewhere between $400 and $600 a treatment.
Okay, great. And then, so what are there any activities? You said most patients are able to just return to work following the procedure?
There's really no restrictions at all.
Okay. And
most of our patients go right back to work. People come in over lunch breaks, things like that, to have this done.
Okay.
Yeah.
And then would you ever recommend PRP for a NeoGraft patient to extend the results of their NeoGraft procedure?
So what we're doing right now is doing a PRP treatment a couple of months after a hair transplant procedure. So the analogy I use, this is like fertilizer. And for guys that are thinning, we can add a little fertilizer to that grass to help that grass thicken. And also for folks who've had hair transplantation, I think, again, it's like a fertilizer. So we're helping those new hair follicles that have been transplanted to grow. So a couple of months after the procedure, we have the guys come back and we'll do a PRP treatment just to kind of kickstart things and get things going.
Yeah. So would you recommend then that they continue with some maintenance treatments then following that first treatment?
For hair transplant, probably not necessary. For guys who have some thinning and they're concerned about it, that is an option. And in some folks, we do a little of both. We'll transplant completely balding areas to get some hair there, and then do some PRP in areas that are thinning to try to improve the density in those areas as well. So sometimes we kind of mix and match things.
Okay, great. Thank you.
Sure. Thank you, Jordan.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.